And welcome to Doc Talks episode 20. Today I have joining me Dr. Matthew Koury. Good morning.
Good morning. Thanks for having me.
Thanks for taking time from a very busy personal life and work life to join us because I think this topic of ADHD is profoundly a part of every parent's life. I don't think there's a parent that doesn't question by the age 5 whether their child might be having some attention issues. I'm going to start with a little background about you, Dr. Koury, and after that, we'll jump right into discussion.
Sounds good.
For anyone joining us, you can, in the public comments below, post a question and we'll add it into the appropriate area. Dr. Koury is the founder and director of the Mind Health Institute of Newport Beach. He is a board-certified child, adolescent, and adult psychiatrist that seamlessly merges his impressive academic credentials with a warm and engaging demeanor. Dr. Koury is known for his thoughtful approach when it comes to using psychiatric medications, and his decisions are always informed by current evidence-based standards. Dr. Koury is also committed to educating his clients and families about their treatment in order to assist them in making the best decisions regarding their ongoing care. Dr. Koury also works extensively in the field of sports psychiatry, working with athletes of all levels, focusing largely on the interface between ADHD and performance. This includes working directly with Major League Baseball, Minor League Baseball, the National Football League, and the United States Olympic and Paralympic Committee. His clinical focus includes medication management for children, adolescents, and adults with a range of issues. He performs psychotherapy for adolescents and young adults struggling with life transitions and mental illness. He does ADHD evaluations and treatments for athletes of all levels, including the above mentioned Major League Baseball and NFL players, as well as the United States Olympic and Paralympic Committee athletes. So let's jump into the hi.
Thanks again for having me, Dr. Vivi.
For all of that.
And thanks for all of that.
I think it's important. I once thought about skipping the introductions, but I brought Doc Talks to social media because of all the misinformation from people who claim to be specialists in areas without the proper training and experience. So I think it's important to list, and I know that's a very short summary of all you've done because my colleagues who work with you have such significant experience with doing studies and learning through the evidence-based medicine under you. But let's jump into talking about commonly missed signs and symptoms of ADD and ADHD. We know that children get diagnosed very young, some very late. How can we help parents understand that their children might have this disorder and recognize it?
Well, I think the important point here is really ADHD, which is really kind of the more contemporary term. Sometimes we refer to ADHD inattentive type, and that was what used to be called ADD. So when I refer to ADHD, I'm including the concept of ADD, which a lot of people think of it without the hyperactive component. And I think the important point is different kids or adults for that matter can look very different. We have a list of symptoms that can often make up the construct of ADHD. And a kid who is inattentive and mind wanders but still does well in school looks very different than a kid who can't sit in his chair and moves all the time and is very hyper. And so the latter child, all of us think of it as ADHD. It really is kind of smacks you in the face in some ways. And sometimes we're like, gosh, how does that person have so much energy? I wish I had that much energy. Yeah. But the former, the kind of inattentive kid who is sometimes very bright and there's a lot of times has a little bit of anxiety involved, so they're not misbehaving in school, often gets missed. Sometimes people think that's more common in young girls, and that may be the case. But there also are many kids who really aren't paying attention in the classroom, but they're not misbehaving. They're not really answering questions and they get interpreted as being anxious, but in reality, they may have a core issue with their attention.
So would you list some of the common symptoms that people come to you wondering whether it is ADHD or not? Would you say it's having to ask a question 4 or 5 times before you get an answer? Because at 5, 6, 7, that's, a parent's struggle is, will you focus? Can you answer me?
Right. I'm going to actually go to one of the primary rating scales. I have it right here next to me. And the first 9 kind of components of that, which are often inattentive issues, are often fails to pay close attention, has difficulty sustaining attention, doesn't seem to listen when spoken to directly, doesn't follow through with instructions, often has difficulty organizing tasks, avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, often losing things. So I think those kind of core aspects of inattention are, as you kind of we talked about just previously, are often missed. And I think sometimes parents, including myself at times, we interpret that as we can misinterpret that as being oppositional, not being motivated, not hardworking, things of that nature. And so I think that those symptoms are just as common, if not more so, when it comes to ADHD than the really hyperactive, impulsive, moving all the time person.
Got it. And first, a 4-year-old, do you think it's important to start looking for signs and symptoms at that age?
You know what we generally say, in general, ADHD is fairly heritable, so it means it often runs in families and clusters in families. It's about the same kind of genetic heritability as our eye color is.
Oh, wow.
And so oftentimes people have a concept of what it is. And it can be I would say it can be a little early. It just depends on how impairing it is. One of the core concepts of the mental health field as a whole is we all have threads or drops of these symptoms, whether it's depression or anxiety or attentional issues. But it's not until those symptoms really congeal together and start getting in the way of life or how we function that we really should talk about them as issues or consider treatments. And so if a 4-year-old's doing well and getting along well at school and learning appropriately, I think you just kind of keep being vigilant until it gets in the way. However, a different 4-year-old may be at the verge of getting kicked out of their pre-K program and have a lot of impulsive, aggressive responses to stressors, and those kids may be on the radar a little sooner. And so it really just depends on the symptoms and how they are getting in the way of someone's overall functioning.
Got it. So as far as assessments and seeing a specialist, if the daily activities, we like to say this in medicine, if you can't do normal daily activities, if things interrupt what would be a normal flow for your child, that becomes pathologic, correct?
That concept is accurate, yes.
Okay, let's move on. I don't have any comments. I do fear since we started early, we might not be live, but we can repost this. That will be fine. We'll
Okay.
go to the treatment options. So, this is, I would say the majority of parents who come to my practice with concerns about ADHD, it takes 2 to 3 years before they really want to talk to me. They almost don't want to talk about it.
Right.
They're scared that I'm going to throw pills down their throat, at their kid's throat, and change their child's personality. They usually grow into a position where they have to because they're going to get kicked out of school or it's going to change their academics. So at that point, the treatment options become, a discussion, but maybe there's treatment options earlier. What would you say to this?
You know, how I like to outline this for folks is in our field, in the mental health field as a whole, we tend to prefer therapy before medications. However, that holds true for many of our diagnoses. And I use depression and anxiety as an example. So if someone has mild depression or mild anxiety, that's not getting in the way of their life, we like to address that very differently than if it's getting in the way of their life. So oftentimes, just for simplicity purposes, I kind of break it down. If it's mild and not getting in the way of your life, we consider really behavioral strategies, exercise, eating well, getting enough sleep, all the things that are really good for our overall health and mental health. Once it crosses into the kind of mild, maybe getting in the way of life a little bit, that's when therapy really becomes the primary and focus. Once it crosses from there into the moderate range, or where you've tried therapy and it doesn't work, that's when we start to consider medications. And then once it's severe, we think medications and therapy really is the best combination. And that's really not all that different. And I often use the high blood pressure as my example. It's really not all that different of a concept.
Yeah.
The challenge with ADHD is we really have a relatively poor evidence for therapies and really strong evidence for medications.
Yeah.
And so it tends to be an area that we lean a little bit more towards medications than we do therapy. And that's really based on some of the early studies. The main seminal study in this is called the M.P.H trial, where they compared psychosocial interventions versus medications versus both, the combination approach. And really, psychotherapy, I don't want to say it doesn't help or doesn't work, but it had relatively thin evidence. The exceptions to that were kids who were anxious, kids who had learning problems, or kids who had really chaotic home environments. And so that's that's really just the overview. And so again, it kind of
interrupt you and ask psychotherapy, examples of psychotherapy, which is the main therapy that you're saying is the crutch before medicine. That would be like cognitive behavioral therapy. What would be some other examples?
It would be, the main therapies we tend to really lean towards these in younger kids that may have more behavioral elements of this and behavioral problems. Is the two that we think of that have the best evidence are called parent-child interaction training and parent management training. And both of those focus on parenting and consistency and positive reinforcement and things of that nature. There's a book, it's written by a Yale psychologist it's called Parent Management Training for Professionals. But there's a spin-off book called The Everyday Parenting Toolkit that I often recommend as a good starting place to learn some of these concepts for parents. But cognitive behavioral therapy also has a role, especially if anxiety and or depression happen to be part of the equation as well.
And I was taught that if there is anxiety, it's critical to manage the anxiety first before other interventions. Is that true?
Partially. So there is often anxiety. The inattentive type of ADHD and anxiety are two of the most comorbid things in our field. And so they often go hand in hand. I tend to look at it a little bit more if the anxiety is kind of focused around issues related to ADHD, kind of getting work done, staying engaged in conversation, engaged in school. Sometimes I personally will consider treating ADHD first, and then often the anxiety symptoms improve. If it seems like the anxiety is a little bit more of a separate entity, then sometimes we treat that first. So that's really sometimes almost a stylistic aspect of the doctor you're seeing.
But that really helps me as a, the first person seeing the parents, because I did wonder and question, what comes first, the chicken or the egg? And I just know that it's gotten back to me from psychiatrists that we need to get the anxiety under control before starting any other ADHD.
Yeah.
I do see it's usually around the things that they can't perform well in at school, and school gives them anxiety because they're not doing well because they can't focus.
Well, and how I like to look at that, Dr. Vivi, and this is if it's clear the anxiety is the primary issue and attentional issues are secondary, or the secondary to that, then we certainly should try treating anxiety first. If it's clear in another situation that attentional issues are the primary issue and anxiety is secondary, we should treat attentional issues first. There are times where it's just they're so like inextricably linked, you can't decide, and you're likely going to have to try to address both in the long term anyway. So we try to do kind of one at a time and figure out a good stepwise approach to that.
In my practice, I sometimes will convince a parent that we don't have to do meds, but for sure we can see, because I tend to see quite an extreme response in kids who are pretty moderate to severe. We can start some meds if they're young enough and they're just not going to be able to be molded to work on some of the concentration issues. And I'm wondering what you think of just doing a trial on, and usually that's when a parent's like, oh my God, I love this, we're going to just stay on the meds. But that's not my point, but it actually helps the parent see that this is really an issue. Have you done that yourself, or is that not?
Yeah, I think of it the same way. I try to, I tell parents, and I'm pretty forthcoming with them. And I know this isn't the style of every psychiatrist out there, but I tell them, hey, initially, when I do an initial evaluation, my role is to do an evaluation and educate you about your options.
Mm-hmm.
I'm not here to force you to take medications or make you feel like that's what you have to do, but it does make sense, if you're concerned about this, to at least be educated about what your options are and what the evidence for these various options exist. And so I often take that approach. And there are parents who are more comfortable trying to go the medication route. And there are often people who have had good experiences with this and are a little more educated about it. And maybe they had ADHD when they were a kid. Mm-hmm. And then there's parents who are a little bit more reticent or a little less likely to go in this direction. And in those situations, I try to educate them about your options and kind of let them know that we're here and available if it gets to that point where it becomes clear that that's what you need to do. I do, however, I guess getting back to your question, there are times, and this is what I tell people, there are times where the best reason to try a medication is because it may help so significantly. And if you never try, you'll never know. And kind of what you alluded to is there are situations that we all see as professionals where medications change a kid's life so drastically, especially their academic life, that it really should be considered. I don't want to give people false hope, but there are, and I wanted them to be realistic about what our outcomes are going to be. But as you know, and I'm sure you've heard this plenty too, is there are some times when people treat ADHD that they use the analogy a lot. It's like flipping a switch. It's like turning the light on, and academically kids become more interested, more engaged, do better. They start liking school. And so those are significant benefits when those are our outcomes.
Yeah, I think there's this known predisposition for doctors to say, let's just try this med, let's do the med. It's only because it's usually 2 to 3 years after a parent's. Right. We have so many patients who've been so hesitant, and then 2-3 years later they try it and they're like, oh my goodness, this is amazing. So, but we have to kind of be cautious of that. And that really brings me to a question that comes up all the time. I was trained in treatment options like 20 plus years ago, and we were just then talking about taking medication vacations and on and off. And I understand there's definitely okay with certain meds. Is this a problem to do, especially for the ones that I'm just saying, let's just try it for a week and see what happens?
Yeah, not necessarily. I think you said you were trained about 20 years ago. I think that was kind of the time where medication holidays were really considered the norm. And that can be helpful for some people. Some of the common side effects of medications is they can suppress someone's appetite. And so for kids, we want to make sure they're continuing to grow and follow the growth curves. And medication breaks can really help with that. What happened, and I don't know exactly how long ago this was, but a study came out that really showed that not treating ADHD has potential long-term consequences. People are at higher rates of accidents of all type, incarceration, drug use, things like that. And so based on that research, the standard of care really became treating consistently. And so, but then subsequent to that, some more research came out. And so it really is, again, just a little bit of a stylistic difference and how a person responds to the medication. Usually I think of it as if someone has a lot of behavioral components of their ADHD, taking a medication holiday isn't ideal because behavior happens in all realms of life, school, social, work. But if they're more of an inattentive type where it's just impairing their functioning mostly at school, then taking a break can be more appropriate. So it really depends on the individual situation. And I have plenty of people I work with that take medication holidays.
Okay, so it is a safe option for people who aren't dangerous.
It can be, yes.
And have you, so the consequences, you touched on some consequences, that's our next subject, of untreated ADD, ADHD. For those who, I've had, dozens and dozens of patients on meds. There was one kiddo who really just didn't like himself, his mood after several years. And he's at a very high performance high school and pulled it together with all the other therapies, but he's one of the only ones that I know went off. And he has a twin sister who ended up going on just for the safety of driving. That's when mom finally realized that she might have it too. She doesn't want her on her phone driving, that kind of thing. But if it sounds like if they actually can, they don't have behavioral issues, but it's more of an academic, there might not, if they can focus themselves, there might be, are there any other consequences besides the obvious of accidents and dangers to themselves?
Yeah, I mean, one of the common, and I know you see this all the time too, you get kids that feel like they're not good at school. And so they underperform at school or they don't like it. Mm-hmm. We see people in the workforce that move jobs a lot or don't ever really engage or function in their job. So really kind of underperforming is a potential consequence. And then and people ask this all the time, and this is a little confusing to them because some of the medications we use, we have to be very careful with because some people can misuse those medications, right? But we also feel that people who have ADHD and are impulsive and they try high risk things and they don't think through consequences, they're more apt to use drugs or take risks or do things that are a little bit more risky in general. And so the concept is sometimes treating that really prevents them from accidents and impulsively trying other illicit drugs and things of that nature. So it really is kind of, as a concept, those are the things that folks with ADHD can struggle with.
I think for teenage girls who are on oral contraceptives, I've seen inability to maintain a schedule with them, which
Of
could cause
course.
serious problems. I also want to comment that there are implications for relationships and making
Absolutely.
friends and having a healthy marriage or happy, healthy relationship. If your spouse is talking to you and you can't hold a conversation with them, that becomes frustrating and a reason for discord. So,
Absolutely. Well, on top of that, too, one of the symptoms, it's one of the commonly missed symptoms of ADHD. So it kind of goes back. And to be honest, it's not on a lot of the newer rating scales, but people who are, well, sometimes I say wired like this because it's kind of how certain people are just wired, their brain's wired, is they tend to be reactive and they get mad quickly or they react impulsively. And sometimes it kind of, as you mentioned, it gets in the way of relationships, and they get angry quickly, and they get in arguments a lot, and it really affects how they interact in an interpersonal way with their spouse or other close people to them in their life.
it's true, and it's a shame on both ends because the person who's reacting really cannot help it.
Right.
It's like a bomb going off in their head. They can't sit and listen to a conversation for the period needed.
Right.
So yeah, I think adults do sometimes find their way to medication when they're not having success in their relationships. So that's
That's right.
another facet. Yeah. Okay, so let's go to our last, I think it's our last. Oh, the executive functioning. This is a good topic because since it's become executive functioning coaching is really hot around this in Newport Beach, and lots of people are finding coaches at schools, even schools are having classes because who doesn't need it? It's like these life coaches that people get now that we're adults, but it's like the exact tools you need when you're going through school to learn how to prepare yourself for your classes and be organized. Do
Right.
you find that there is success and a important tool for ADHD, or is it just some kind of
They certainly can be. I think it's what's important, and this is kind of true of medicine and mental health care in general, is if you find someone good who's a good fit for you, they can be invaluable. But the challenge sometimes is finding the right resource and getting connected to the right
Yeah.
resource. In one of the things I mentioned as being one of the symptoms of the inattentive style of ADHD was really difficulty, and this was kind of touching on executive functioning, but difficulty paying attention, following directions. Sometimes we think of it as when people have challenges following multiple step directions. Say I ask my child to run upstairs, grab your notebook for school, grab your shoes, brush your teeth, and come back down. The kind of classic challenge is you go upstairs and do the first thing, and then you forget what the rest were and get distracted by something. And the kind of organizational aspect of how to manage those things, which are really important in the work environment or in school, can be really helpful. I often think of it as, back when we went to school, it just wasn't as much busy work. And so it was a little easier to compensate if you were wired like this, to compensate. And sometimes we had 5 hours after school to finish 45 minutes of homework. So you really didn't have to be that efficient to get the 45 minutes done, right?
Yeah.
You could space it out over the course of a lot of free time. Our kids, especially in environments like Orange County, oftentimes they have 3.5 hours of homework and they have 3 hours of free time after school. And so it creates a challenge for people who aren't organized and efficient getting their work done, creates a lot of stress. And so the whole concept of executive functioning is someone who can teach you how to organize yourself, how to triage what's most important, what needs to be done tomorrow versus what needs to be done next week. Those concepts are really important when it comes to performing well in a challenging school environment.
Yeah, I think it's a great new blossoming field. I just wanted to get your perspective, so thanks for sharing. I'm guessing it's a lot of what you would do if you had extra time outside of just talking to them about their therapies, their commonly used therapies. So the genetic, you touched on this, and I wanted to mention that I was reading something recently that was impressive. The heritability of anxiety is now seen to be strong from father to son. Well, this was a study, so who knows, right? We have one study, but there's a link. It's more likely to be inherited father to son, mother to daughter. And the summary was that this proves that it's not genetic as much as it's environmental. Makes sense. But I've been really working on parents and anxiety because conversation they're having in front of their kids during the pandemic, the way they're reacting to things in front of their kids, not touching door handles. I bring it up right away because I say your child's going to have anxiety if you keep performing like this. And I would therefore think a lot of it is environmental. But it's interesting that with ADHD, you were saying it's inherited just as much as eye color.
Yeah, it's one of the more heritable things in the mental health field. I tend to like this concept, though, and I learned this back when I was in training, is it genetic or is it environmental? And I like the answer. It's 100% both. Both are such important components that it's not sometimes teasing out how much environment versus genetic it's really kind of a academic argument, but it's not that important really when it comes down to the clinically how these things present.
I was wondering if it's executive functioning is learned. So I'm wondering if you're learning behaviors by watching your parents be impulsive, or you're learning behaviors by not getting trained to be organized.
Absolutely. Absolutely. I think that's where I think it's 100% both, because I think that is true, as is the fact that it's heritable. And I think what's important to point here is there's this concept among parents our age that we diagnose ADHD so much more. Right. And that somehow it's a new concept, which really all the evidence suggests otherwise. It's always been around. It is probably 5 to 8% of most populations in the world. And I can tell you it happens multiple times a week. Someone comes in, I'm interviewing the kid, I'm talking to the parents, and their concept is ADHD is new, it's not. But then when you start talking to them, one of the parents is either like, oh, I'm just like this, or they're just like this, or we're both a lot like this.
Yes.
And so
it always, yep.
Really more often than not, it really is more of an exception when a kid is inattentive or has ADHD and neither of the parents identify with it at all.
So it really might speak to parents seeking some help for themselves too, once they're noticing if it's affecting their relationship, their parenting style. I feel like that's just a lost cause. We don't really work on parents. At least that's not my world, right? And I work with kids, but I don't know if parents look in the mirror and say, oh, maybe we don't have time as parents, but it's important to maybe consider what you're modeling. Yeah.
Yeah, no, I absolutely. And another thing that's often, it's just, again, multiple times a week, is one of the parents who's wired like this, their concept is, well, I dealt with it and I pulled myself up by my bootstraps and got through it, so my kid should be able to. And again, that may or may not be true, but it's got to remember that school and what our kids really juggle, the stressors they deal with, are just very different than what they were 20 plus years ago.
Yes, they're asked to manage quite a bit more, and so they really can feel like a failure. The playtime and the unstructured time isn't there like it was for kids who had that outlet. What are your thoughts about planning early in the day for the ADHD, the hyperactivity, making sure they wake up a little bit early and get their kid out for a walk, run, playtime? Does that help?
Yeah, it could potentially help.
I always try to find non-medication options for people who are in that warm-up period. They're not sure they want to do medications,
Right.
and find tricks for them to help
Well,
their focus.
and that goes back to kind of what we kind of outlined a little earlier. And when things are mild and not really getting in the way of life, I mean, healthy lifestyle, eating well, sleeping enough, kind of exercising, whether it's yoga or surfing or really whatever it is that's your outlet, I mean, that really helps in all aspects of life. And so certainly can help people who kind of have ADHD, just as much as it can help someone who's depressed or is overweight or has high blood pressure. And so I think those kind of healthy living concepts are important to always be mindful of.
Great. Are there any tips or pointers you want to end with? Things you think people should know to help them? Parents.
Yeah, I think just from my perspective is always be curious and open-minded. And there are sometimes, like I said, just because someone's wired like this doesn't necessarily mean they have to be on medications.
Mhm.
And I think that concept is really what we need to break, because there is such a concept that ADHD equals medications. And also, just because there are people out there that misuse these medications, that does not mean ADHD isn't an accurate or an appropriate concept. I find that to be very common as well, because we live in a day and time where a lot of kind of young people, high school students, college students, kind of misuse these medications to stay up all night and study or perform better. And they probably don't have ADHD, but it doesn't mean that the subset of people who do have ADHD can't benefit from being appropriately treated.
I have a question about on that topic. Are those meds going to be as helpful? Not nearly as helpful as if they really had ADHD, correct? As far
Yeah,
as
probably not. But again, it is so common. And that was also kind of an older concept, but it is so common that you meet young people nowadays that really don't have ADHD, but are using them more for performance enhancement. And that's not something that, as a kind of traditional, in our traditional field, we support, but it really is very common, unfortunately. And
yeah.
so, and that's where that kind of circles back to when you introduced me. My interest has kind of been on this interface between performance and ADHD, and that really touches on academic performance, performance in sports, all kinds of things. So we really do feel like if someone really truly has this condition or is wired like this, so to speak, that treating is an appropriate option. However, if someone is not, we don't feel like treating is really treating with medications is the appropriate route.
Well, it'll be great for people to connect with you in person if they are, standing right in the middle trying to decide what's right for them. And I would love for people to find you at M.H.I. That's the acronym for Mind Health Institute, Newport Beach. That's your handle on Instagram, and they can find your other accounts from there. Thank you for your time. I will circle back if I get some questions from patients or viewers. because I'm not sure if this went live, but if it did, great. We'll have some feedback anyhow. Thanks for your time. You have a great day. Happy Friday to everyone.
Thanks again for having me. Take care.
Bye-bye.